everyone, welcome back to my channel. I'm Melissa Braven. I'm a singer, songwriter, and I make videos about music and life as a creative. If you want to be notified whenever I post new content, be sure to hit that subscribe button now. So today I want to talk about my experience with hearing loss and my recovery from hearing loss. So I experienced hearing loss in my mid-20s, and at the time it was really upsetting, and I was frustrated by the lack of content that I saw for people who were in their 20s experiencing this. So a lot of content for hearing loss is usually geared toward older people because we typically associate hearing loss with getting older. But there's actually a lot of people who are younger who experience hearing loss too. So I'm hoping that by sharing a little bit about my experience that it will be helpful to you, especially if you are experiencing some hearing loss yourself. So my experience with hearing loss started one fateful morning in April several years ago. And I just really rolled out of bed and noticed a difference in my hearing. So right away I could tell that my hearing was a little bit different. It seemed like things were a little bit muted in my left ear, kind of like having a hand over one of your ears. And I also noticed this feeling of fullness in my ear. So because it was spring in the Northeast, I just assumed that it was allergies because I have seasonal allergies. So I just kind of shrugged it off and went about my day as usual. I noticed then after a couple of days that I was also feeling dizzy, and the room would sometimes spin on me, or if I was walking to the subway, the ground would sort of bounce up and down a lot as I was walking. So I would have to stop walking, move to the side of the sidewalk, and just wait a few moments for things to stop spinning and kind of bouncing in my line of sight. Sometimes this would also happen if I was sitting still though. So I might be sitting at my desk at work and suddenly the room will just turn sideways and start to spin, and it feels like I'm in a tilt-a-whirl. So I thought, okay, these are really severe allergies this year, but I just let it go. And then after about 2 weeks, I said, okay, this has been going on for a little while now. Even if this is allergies, this seems a little bit severe for me to be having dizziness when I'm walking, and it's making me feel a little unsafe because nobody wants to stand on the subway platform and suddenly have a dizzy spell when a train's coming into the station. So I made a doctor appointment. I didn't actually have a primary care provider at the time, so I used a platform like ZocDoc or something just to find a doctor that had an opening fairly soon. And I found this doctor. He was in Midtown. He had good reviews actually, and it was convenient because it would be on my way home from work. So I said, great, I'll stop at the doctor on my way home from work, it'll be fine. There was a torrential downpour the day that I went to the doctor's office. I got completely drenched and I thought, well, great, this isn't gonna make me feel better. This isn't gonna make my hearing feel better. I might get sick from this. I was in the doctor's office waiting for over an hour past my appointment, even though there were no other people in the waiting room. Anyway, I get brought in by the doctor and I'm sitting in the room waiting for him to do the exam on my ears, and he couldn't find an otoscope. So an otoscope is the device that doctors use to look inside your ears and see if there's an ear infection. So at this point I'm wondering, because it's been 2 weeks that I've had symptoms, if I have an ear infection but without pain. But if the doctor can't find an otoscope, he's not going to be able to see if there's inflammation in my ears. So the doctor and the nurses looked throughout the entire practice and couldn't find an otoscope. So the doctor comes back and says that he has to cancel the appointment because there's no way for him to look in my ears and examine if I'm healthy. I go home and I'm so frustrated by that experience that I just say, you know what? It doesn't matter. My ear isn't in pain, and all of the experiences that I've had with ear infections is that I would have pain in my ears. So I decided it probably is just allergies. I'll give it another week or two and I'm sure it'll clear up. Another week or so goes by and I'm practicing some vocal exercises in my room. So at this point, I'm not practicing vocal singing as much because I thought the allergies were kind of bad and I didn't want to irritate my vocal cords by practicing too much. So I'd given myself kind of a break while I was feeling off. I was practicing guitar though, and I was noticing as I was playing guitar that I was having a hard time hearing if things were in pitch, which didn't usually happen when I would play guitar, but I noticed that I would have to bring the guitar like very close to my ear to feel like I was really getting the pitch. And I remember I was taking lessons at the time and I remember asking the teacher, does this sound in tune to you? Because it's just sounding weird to me. I was also singing with a vocal group where it was a duet and sometimes a trio. And I remember noticing in the practice room that I wasn't hearing things quite right. Thought I was in tune, but I had to keep checking in with them. Like, are you sure I was in tune there? Are you sure? When I did my vocal warm-ups, I noticed something really off. I had a couple of pitches going in my ear at the same time. It was kind of like, it sounded sort of like a space echo, like if you use an effect when you're producing music. So I was hearing a couple of pitches and a low grinding noise, maybe like a coffee grinder. So now I'm scared because I'm a singer, and if I can't hear my own pitch, how am I ever gonna sing again? So that's when I booked an appointment with a specialist. So again, I found a specialist on ZocDoc. The experience was I went to the ENT specialist office and I had a hearing test. ENT is an ear, nose, and throat specialist. If you haven't been to one before, that's what ENT stands for, and I'll be using ENT throughout this video. So when the doctor came in the room, he told me that I had actually lost the lower frequencies of my left ear. So all of the low frequencies were gone. He showed me the chart. They'll usually show you like a chart where it shows you the frequencies that your ear can hear, and there was no responsiveness in my left ear for the frequencies that were lower during the hearing test. So he diagnosed it as sensorineural hearing loss, which in lay people's terms, because I'm not a doctor, clearly, it was sort of described as the nerve that connects your inner ear to your brain stops working or partially stops working, so that your brain isn't really interpreting the sounds that your ear is catching. So when he told me this, first I cried. He was very nice and gave me tissues. Then I asked him a couple of questions. So when I was a kid, I had a lot of ear infections, and I asked him if that could have any effect on my hearing now as an adult and could have caused the hearing loss. He told me no, that wasn't usually a factor. So then I asked him about headphones or earbuds. Could it have been a result of using earbuds too often or having my music too high? And he said no to that as well. It kind of just happens to some people, and there wasn't typically a way of tracing it based on their behaviors or their past medical history. I asked him if it was uncommon for someone like me in my mid-20s to have this kind of experience, and he said that it wasn't uncommon, but it wasn't super common. So he said at their office location, they would have about 2 people in their mid-20s per month come through their office and be diagnosed with sensorineural hearing loss, which honestly is more than I expected, because we don't really hear about people in their 20s losing their hearing as often. I also asked him if it was an indication of any more serious condition. He said no, it's generally not an indication of something more serious. Now, again, I'm not a doctor, this is just my experience. So if you're experiencing any kind of symptoms, I do suggest that you see a doctor and find out what's going on with you. So the doctor also told me that after about 2 weeks of being symptomatic, it's difficult for patients to recover their hearing. So at this point, I'm about 4 weeks into being symptomatic. So I'm scared. So despite being symptomatic for 4 weeks, he asked me if I would like to try any recovery plans for my hearing, and I said yes, absolutely. So he offered 2 options, and I feel very fortunate that they treated my hearing loss more aggressively. He said that there was an oral steroid that I could take for about 2 weeks. It was a pretty strong steroid. Or I could have a liquid steroid treatment that would be injected directly into my middle ear. Or I could do both options. And I said, I will do both options. So I went back to the office later that day with an appointment to see a different specialist who would do the procedure of the liquid injection into my ear. So basically the way my process went is I just sat in an office chair and they numbed my eardrum with some kind of numbing agent. And then the doctor took a needle and stuck it through my eardrum and filled my middle ear with a liquid steroid. So it was about as unpleasant as it sounds, like it really wasn't great, but it wasn't a very painful process. It was just uncomfortable. So I don't want to scare you if this is something that you ever have to do. It really was doable. They said that they would do 1 to 3 injections, and it would depend on how well my ear recovered after each injection. So I was fortunate that I only had to go through 1 injection of this and the oral steroid. So when they did that first injection, I had to sit very still for about 20 minutes, and you're not allowed to swallow because swallowing will actually drain your ear canal. So if you swallow, then the steroid will go down your throat and not stay in your ear where it needs to be to reduce the inflammation. Also, the steroid is very bitter and it tastes terrible, so you don't want to swallow it even if you tried. It was kind of an emotional process. I would say that the emotional component was actually worse than the physical procedure. I went to the office by myself as well, while also experiencing dizzy spells. And then after I had that procedure, I went back to work and finished up my day. And I really wish I had just gone home directly after that. So I recommend, if you ever have to go through that procedure, if you can have someone come with you, I think it can be helpful. I'm pretty sure they recommended that you don't drive right away after that procedure because the liquid in your inner ear can make you feel a little woozy. Thankfully, I was okay to take the subway home. And then I also took the oral steroid for about 2 weeks, which caused some, acne and breakouts. But between the combination of the oral steroid and the liquid injection, the next follow-up that I had a few weeks later at the doctor's office showed that my hearing had actually recovered. So they said that I had recovered all of my low frequencies, and I was able to see on the chart that they presented me that my ear and my brain was actually capturing the low frequencies from the hearing test. So that was a huge relief. Honestly, I feel like it was kind of miraculous that I was symptomatic for 4 weeks and that they were able to recover my hearing loss after that point. So there were some follow-ups that I had to do as well, because my eardrum wasn't healing fully after the initial puncture wound when the liquid steroid was injected into my ear. Mine took a long time to heal. I'm just a slow healer, I guess. So they had to put a little biomesh band-aid on my eardrum to make sure that I didn't get an infection by getting water in my ear in the shower or something like that. So I just had to be very careful about protecting that ear when I was in the shower, or if I had maybe been walking around on a windy day, I might want to cover my ears a little bit. I also want to mention that after I had the injection and started taking the oral steroid, I was advised to have an MRI. Sometimes in a small percentage of these hearing loss cases, there can be a very small tumor in your inner ear. And the doctors told me that that kind of tumor would not be cancerous or life-threatening, but that it was important to have it removed just for my own safety and for the sake of my hearing. I did go to have the MRI done and found that there was no tumor, so I was very fortunate there that I didn't have to go through a surgery to remove that kind of tumor. But you should just be aware of that, which is why it's important, if you're having any of these symptoms, that you go see a doctor and have things checked out. Also, I took myself to the MRI by myself, and I recommend maybe having someone take you to an MRI because it was also a little scary. I feel a little bit like a wimp that I was scared, but I was scared. And then I took myself on a shopping spree to reward myself afterwards because I felt like I was very brave to go by myself. Can't spell braven without brave. Okay, we're moving on. So I went back to the ENT to have my hearing tested more than once because I continued to be symptomatic on and off. So as I mentioned earlier, there was a feeling of not being able to hear as well. So my left ear would sometimes feel a little bit muted, or it would seem like there was a hand covering my ear. There could also be feelings of fullness in my ear, just like fullness, almost like that sense where you get water in your ear after swimming. Sometimes I would also notice ringing or tinnitus in my ear. Sometimes there would be popping sensations like a pressure change, like when you're on an airplane or go through a tunnel. And then I would also have dizzy spells. So sometimes the dizzy spells would last for 20 or 30 minutes. Some people who have vertigo spells, it can be for a very long time and they can be really debilitating to the point of getting sick and vomiting. I was really fortunate that I didn't have them that severe, but sometimes it would be enough that I'd have to lay down, turn out all the lights, and put something over my eyes so that I didn't see any light movement in my room. Sometimes it would happen at work when I was just sitting still. I remember having to lay down at work more than once because the room was spinning, so that was kind of crappy. So because the additional symptoms like the dizziness, the ringing in my ears, the fullness feeling, all kept coming back on and off throughout that year, the ENT advised me to have a Meniere's test done. So Meniere's disease is a condition of the inner ear that can be lifelong, and it can be very debilitating for some people, but it can come and go throughout someone's lifespan as well. My symptoms weren't quite that severe, so he wasn't sure what my diagnosis might be, but because my symptoms kept coming back, he said it would just be worthwhile to have the test done. So one of the things that they did during the Meniere's test is blow warm air into each ear. When they do that, it induces vertigo symptoms. So be prepared that if you ever are doing a Meniere's test, that it will just be kind of like a simulated vertigo experience, which isn't fun for most people. It wasn't fun to experience, but the person doing the test, I believe it was an audiologist doing the test, she was phenomenal. She was so nice, asked me lots of questions about just fun things like ice cream and whatever, but it was a little bit uncomfortable just having to sit in the chair and have to experience induced vertigo. So after that test, it turned out that my result was actually negative. The ENT did say that because I had been symptomatic for a prolonged period of time, that even though my test came back negative, it was quite possible that I have early stage Meniere's disease, which means as I get older, this is something that could come back and could come back more strongly or intensely as I get older. So he gave me a booklet about Meniere's disease with some lifestyle changes that I can adopt to manage some of these symptoms. So a couple of those lifestyle changes, just to list them quickly, is to reduce stress, increase your sleep and the quality of your sleep, reduce caffeine intake, reduce alcohol consumption, and reduce sodium consumption. So it's a lot of just improving your lifestyle overall. Unfortunately, to my knowledge, there's no cure for Meniere's disease. Because my diagnosis came back negative, but the ENT thinks it's possible, I'm just trying to adopt as many of these lifestyle changes as I can so that I don't wind up in this kind of situation again in the future, or that if I do, I can possibly minimize the intensity of it. I hope this was helpful, and if you're experiencing any of the symptoms that I mentioned, or if you're experiencing any kind of ear pain, or you're just not sure if something's quite right with your ear, I highly recommend seeing a doctor right away. I continue to have some of these symptoms on and off, and sometimes I can trace it to some of those lifestyle changes that they recommended, where maybe I haven't been doing as good of a job of managing my lifestyle in the ways that reduce the symptoms of Meniere's. So next week I want to spend a little bit more time going over those lifestyle changes in some more detail, and then if those are lifestyle changes you're facing, I hope that that video can be helpful to you. So check back next week for more information about that. Thanks for tuning in this week. I hope this video was helpful. If you liked this video, be sure to give it a thumbs up and hit the subscribe button to subscribe to my channel. You can also hit the bell icon to be notified every time I post. I'm Melissa Braven, and I'll see you next time.